Welcome to the IBS-80 video series on patch testing for irritable bowel syndrome. This video is directed primarily toward medical providers interested in learning how to perform patch testing. It provides an introduction to the utility of food patch testing for the evaluation and management of irritable bowel syndrome, a step-by-step patch test tutorial including how to interpret results, and resources for patient guidance and further provider education.
My name is Dr. Mike Stierstorfer. I'm a dermatologist and the developer of IBS-80. IBS-80 Basic and IBS-80 Plus are two newly developed sets of food allergen patch tests that can identify food allergies that may trigger symptoms of irritable bowel syndrome and that are now available by prescription to medical providers. The patch testing procedure itself with IBS-80 is the same as for traditional patch testing. The difference lies in the allergens. For traditional patch testing, the allergens used are those known to commonly cause allergic contact dermatitis. For IBS-80 patch testing, type 4 food allergens are used, and these foods may also elicit patch test reactions in the skin. Recent studies have shown that when foods identified by the patch testing are eliminated from the diet in IBS patients, their symptoms often improve or completely resolve. This testing is completely different from prick and scratch testing, which tests for immediate type allergic reactions and has been shown generally not to be useful for IBS. Traditionally, patch testing has been a diagnostic procedure performed largely by dermatologists and some allergists. With the newly discovered utility of food patch testing for irritable bowel syndrome, it is anticipated that practitioners in other fields such as primary care and gastroenterology will also be interested in incorporating it into their practices or, with raised awareness, refer their IBS patients to practitioners already trained in the art of patch testing. To newcomers, patch testing may seem complex and difficult. In reality, once the fundamentals are learned, it is actually quite straightforward and an enjoyable skill to add to the armamentarium of available services for the betterment of patients' health and quality of life. The fundamentals illustrated in this video are relatively standard and are applicable to patch testing in general, as well as to type 4 food allergen patch testing for irritable bowel syndrome. Patch testing technique may vary among experts.
IBS-80 Basic and IBS-80 Plus Patch Test Kit.
As in traditional patch testing, the large majority of allergens used for IBS-80 are petrolatum-based, while a minority are liquid-based. IBS-80 Basic consists of 80 food allergens in total. IBS-80 Plus consists of over 100 allergens. Patches consist of 2 columns of 5 small test chambers or wells, each well containing a different type 4 food allergen. Most wells are pre-populated with the petrolatum-based allergens. Small aliquots of each numbered liquid-based allergen are provided separately for application to their corresponding wells within 1 hour of use. Each patch comes labeled in its upper left column with the number of the first of the 10 wells on that patch. Numbers for the remaining wells are determined by their position on the patch in downward order for each column, as shown here. The specific food allergen in each well is listed on the data collection form, which accompanies the patches. It is critical that the numbering for the foods on the patches is understood so that the patch testing yields meaningful results. The patches are almost ready to use upon arrival, but will need some processing before use, described later in this video. After receiving the kit, store it under refrigeration until the day of use. Patches should be used within 12 days of receipt.
Day 1. Patch Test Application.
Each side of a patch has a removable cover. To prepare the patches, keeping them in numerical order, remove the firm molded plastic cover from each patch to expose the previously occluded food allergens. Take care so the sticky exposed surface doesn't fold and stick together. Place them sticky side up on a hard surface. As mentioned, patches that hold liquid-based allergens come with empty wells that must be filled with the liquid-based allergens within an hour of application on the patient so that they remain moist at the time of testing. Place a drop of each numbered liquid-based allergen onto the empty well in the same numbered position on the patch. It is crucial that each numbered liquid-based allergen be placed in its correspondingly numbered well to allow for accurate reading later. When applying the patches, the patient may be gowned from the waist up with the opening in the back. Women should remove any undergarment, which they may again wear after the patches are applied. Gently prep the back with rubbing alcohol. The back should be free of any lotions or oils, and any back hair should be shaved at home 2 days prior to the first appointment. Apply the patches in numeric order in 2 rows on the upper and mid-back. For smaller backs, the last 2 patches or so may need to be placed horizontally below the other patches or on the arm. Space the patches evenly and be sure not to overlap them. Avoid placing any patch directly over the spine as they do not adhere well over this site. After all patches are placed, carefully peel off the clear plastic backing without pulling off the patches themselves. Press each patch for a few seconds to enhance adherence. To minimize the risk for the patches to loosen and negate the results from any of the non-adherent sites, counsel the patient to avoid showering, exercise and excessive perspiration, and or bending the back too much for the 48 hours that the patches are in place. Sitting in a tub or sponge bathing are permissible during this time.
Day 3. 48-hour visit. Patch test removal and first reading.
Examine the back to be sure the patches are adherent to the skin. When the patches are removed, there may be a small outline of each well on the skin, which is evidence of adequate adherence. Any wells that come loose and are not in close contact with the skin for the entire 48 hours invalidate the test for the specific food allergens in those wells. Before removing the patches, using a non-permanent Sharpie or other felt marker pen, systematically place dots on the skin between the aligned wells at the side borders and upper and lower borders of each patch, as demonstrated in this video, so that when the patches are removed, lines can be drawn to construct a grid that delineates each allergen position. Some patch test authorities choose to outline each patch or the corners of each patch rather than draw a grid, determining the position of each well the same way a numberless watch can be read. Next, remove the patches gently in a diagonal direction to minimize patient discomfort. Wipe off any allergen residue with tissue paper or an alcohol swab. Then, finish marking the back by connecting the dots horizontally and vertically between the wells. Each grid will outline 10 wells. The test sites are all numerically aligned, with allergen numbers 1 through 10 in the upper leftmost grid on the back, and the remainder following in order. Once the marking is complete, closely examine each allergen contact site with good lighting. Natural daylight or full spectrum overhead fluorescent daylight bulbs provide the best light. Record the 48-hour reading on the data collection form.
Patch test readings.
There are 6 potential outcomes of a patch test as follow. Negative, normal appearing skin under the test chamber, no evidence of redness. Questionable reaction, macular erythema, in other words, a light red or red flat area under the test chamber. Weak or 1+ reaction, a slightly raised, slightly edematous red papule or papules. Strong or 2+ reaction, more raised, edematous red papules or papulovesicles. Extreme or 3+ reaction, red with a blister or ulceration. Irritant reaction, red with a shiny surface, cigarette paper-like wrinkling, or follicular pustules or burn-like reaction. Using the keywords patch test images, many more examples of patch test reactions can be found on the internet. The first reading is sometimes difficult due to generalized redness from the adhesive patches, especially in patients with sensitive skin. This redness typically fades within 48 hours. Also, because reactions may not appear at 48 hours, another visit at 72 or 96 hours is necessary. If the markings are fading, the patient may have someone at home carefully remark the lines again the following day. In the case displayed here, there are 3 positive reactions at 48 hours. Numbers 33, cinnamon bark oil, 106, carmine, and 108, sodium bisulfite. Caution the patient to not wash or get the back wet until after the final reading at 72 or 96 hours. It is essential that the markings remain in place so that the food allergens causing reactions can be identified at the final visit. It may be helpful at this point to use wax paper to draw a template outlining all patches so that if the markings on the back have faded or disappeared, the template may be used at the final reading to approximate the location of each patch on the back.
72 or 96 hour visit. Second patch test reading.
During the final visit, again closely examine the tested areas with good lighting. The wax paper may be used to more precisely determine the location of the grids if any have faded. It is crucial to identify each skin reaction by its numbered position on the marked back so that it can be precisely matched with the correct food allergen on the data collection form. Record the reading on the data collection form. In the current case, there were 3 new questionable reactions at positions 12, caraway, 14, asparagus, and 8, 2,6-di-tert-butyl-4-cresol, or BHT, pointed out in that order, as well as persistent strong reactions at positions 33, 106, and 108. If a spot was red at 48 hours but has disappeared at the 72 or 96 hour reading, it likely was not a true allergy, but rather due to pressure or irritation. It should not be included in the final results. The testing is now essentially complete. The patient may shower after this point, but should face the shower head and not wash directly over the back for a few more days, since occasionally late allergic responses become evident during that time period. Advise a return visit should the patient observe any new spots. After the final reading, any pruritic reaction sites may be treated with a mid or high potency topical corticosteroid cream for a few days.
Patient counseling.
IBS-80 prescribers are provided access to a food avoidance information database useful for patient counseling. During the last visit, discuss all questionable and positive patch test results and review and distribute avoidance information. Advise the patient to avoid the foods in question for at least 1 month and indefinitely if IBS symptoms improve or resolve. Improvement often occurs within days or weeks. While even foods with just questionable reactions may be playing a role, the patient may re-challenge with these foods after the 1-month period. To receive follow-up, a food avoidance questionnaire provided with the patches and available at IBS-80.com should be completed and returned by the patient to the provider 1 month or more after start of the avoidance diet. Further resources are listed here, including the step-by-step tutorial IBS-80 food patch testing for the evaluation and management of irritable bowel syndrome, available on YouTube and on the IBS-80 website. Thank you for watching. I hope the information in this video helps you help your patients.